Hi there, I'm Dr. Kathleen Young. I'm a board-certified child, adolescent, and adult psychiatrist, and I'm also a certified life coach, and I do all kinds of things in my professional life. But one of the things that I really feel passionate about is autism spectrum disorder and neurodivergence. I have been in clinical practice for about 20 years, and I think that we have really the missed the boat on this diagnosis, and it's a really big blind spot in mental health. And I think the most recent estimate is around 20% of our clinical population is on the spectrum. And so what does that mean? What that means is we're missing a lot of people, and there's a lot more autism and neurodivergence out there in the general population. And so I have just become very invested in it. I'm also a parent of a child on the spectrum, and so that's one of the reasons. But that wasn't even the biggest one for me. For me, it was that I was working with all of these adolescents in my private practice and who were really struggling. And they had all these psychiatric diagnoses and they kind of fit, but at the same time, never really were the full story and never really fully explained what was going on and didn't feel satisfying. And so I just became more interested in neurodivergence and understanding, why certain things were happening and why certain of my patients were having the challenges they were having. And so over time, I've developed an interest in what I'm calling less obvious presentations of autism spectrum disorder and neurodivergence in general. And so I'm going to be posting videos here so that you can also learn more about what it is and why so many people, it seems, now have autism. If you go on TikTok or Instagram, there's all kinds of people posting about it. And I think, as with anything, when that happens, that people are skeptical about it, but it's real and it's here. And my hope is that if we can start to identify it, because once I started to identify it, it just was like a light bulb went on. And there were all these people that I've seen over the years, because I'm a child psychiatrist, I work with people over their development. And I can look back and I'm like, oh, that's what that was. It all makes sense now. And so my hope is for you, if you're a parent, I work with a lot of parents. If you're a parent and you're wondering, there's something that's like not right, but you don't know what it is with your kid, or if you're a person who's curious about what's going on, hopefully these videos can be really eye-opening for you. So on that note, enjoy.